Hello everybody, my name is Leon. I work at Evolution's Treatment Center. Now usually I shoot videos on various topics for those suffering from the disease of addiction or the early recovery process, but I wanted to do something different and I wanted to start making more videos for the family members and the friends of the addict or alcoholic. I am also a recovering addict. My clean date is December 19th. 2012. So I've gone through the whole disease of addiction, the whole treatment process, and still going through the recovery process, coming up on 8 years in December. So when I talk to you guys, I'm going to be speaking to you from a standpoint of a primary therapist and also one individual who has been through the whole disease of addiction and recovery process. I'll also be talking to you as someone who have gone through this whole addiction with my family members and how it affected them, how it affected me, what works, what doesn't work. So I look forward to telling you guys what does work. Now I want to encourage all the family members and also friends of the addict or alcoholic to join our support group on Facebook. It is completely private. All you have to do is go under groups, hit search, and type in Family and Friends of Addicts Support Group. There you will find other family members and friends who have gone through what you are going through and can help you learn and offer support on how to deal with this family member who is struggling with active addiction right now, or one who is struggling with the early recovery process. It's a phenomenal group. There's tons of support available and resources, and I hope you guys all join. So I'm going to be talking to you guys, the family members and friends of addicts, on various topics. So dear family and friends of the addict, let me help you get into the addict's head a little bit. I truly believe that addiction is a thinking disease. It's also a family disease because it affects everybody in the family. I wanted to share with you guys my experience going through addiction just to help you understand more about the addict. And this is a similar experience for many addicts and alcoholics. So for me, it started when I picked up my first substance, which was wine. It was sangria. And the first time I ever picked it up and I felt the buzz, I knew, I even told myself, I'm like, this is what I need to feel like all the time. You know, I remember just walking down the streets of Barcelona and the sun is coming down and I'm feeling good. And I really, at that point, I taught myself that this is how I escape, this is how I feel good. So basically from the age of 12, that's when it really all started for me. And the disease of addiction is a progressive disease. So for many years I would just experiment, use different drugs on the weekends, going through high school. Then my addiction became a lot more severe in college, and I started picking up substances that are much heavier. And you know, for many years I was in denial. I thought that I'm not an addict and I just use occasionally, or I made all sorts of justifications and rationalizations why I need to use this substance. Oh, this helps me with my anxiety, this will help me study, this helps me talk to girls, I feel more comfortable, this improves my self-esteem. So I was full of justifications and rationalizations, and God forbid if anybody told me that I'm an addict and have a problem, I would completely deny it. As the years went on, things definitely got worse for me. I started doing things that I never thought that I would. I started manipulating my family, manipulating my friends, anything that I could do in order to continue getting high. As I was saying, addiction is a progressive disease, and it continued on getting worse for me. Now, there was a point where eventually I admitted to myself that I am an addict. And the part that I could not admit is that it makes my life unmanageable, because I always thought that for the longest time in my addiction, I thought that I could use successfully, that, you know, I could still maintain relationships with my family, with my friends, go to my job and be successful in life. But however, as time went on, addiction kept proving me over and over that I cannot use successfully, that every time I pick up a substance, my life becomes completely unmanageable. My family is embarrassed of me. They don't want to talk to me anymore. I'm burning bridges, no friends left, cannot hold a job, and my sole purpose just becomes to get high. What do I have to do in order to get high? And addiction, to feed it, people do all sorts of things, including myself. I've done some things that I'm not very proud of, because once that disease takes over, it's very hard not to do those things to get the fix that you need. So throughout my whole addiction, I've gone through several treatment programs, and I'm going to be sharing about the experiences in treatment and what worked for me, what didn't, and what my family did that helped and what my family did that didn't help. And I will be talking about those in future episodes of family education. Let me start off with the most important thing. Dear family and friends of the addicts who are watching this, the most important thing is that if the individual is in active addiction right now, or maybe they have some time in recovery and they just relapse, the most important thing is getting them back into treatment, because you will not be able to help them out. This is where the professionals come in, and being in treatment setting is what's going to help them out. So the most important thing to do is to make sure that you get your loved one into treatment where they can be helped. Now, let me tell you a little bit about our program at Evolution's Treatment Center. We have a full continuum of care. So that means we have all the levels of care, that with each level of care, it basically reintegrates the individual back into society again as a functioning, sober member. So the first level, it starts off with inpatient detoxification. Your loved one has probably been using substances for some time now, so they will need detoxification, and that is the first step of our program. They come into our inpatient detox. They will meet with a psychiatrist, and based on the amount of substances that they used and for how long, the psychiatrist will determine the right detox for them to ease their withdrawal symptoms and cravings. While at the detox level of care, they will meet with a psychiatrist every day and with a primary therapist. And we're going to assess them as they're going through the detoxification process and guide them and help them in any way that we can. Once they get off the inpatient detoxification level of care, they will be at the inpatient residential level of care. So that means no more detox meds, and some of them are going to experience some post-acute withdrawals. There are so many post-acute withdrawals. It could be anxiety, sweats, chills, low frustration tolerance, irritability, lack of energy, tremors, feelings of depression, hot cold flashes, poor concentration, nausea. The list goes on. So many people do experience the post-acute withdrawals, and that's why they usually spend about 2 to 3 weeks just at the inpatient residential level of care, where we can medically stabilize them and introduce them to the whole recovery process, where they start learning coping skills on how to maintain long-term sobriety. Now, a lot of people that do come to treatment, usually there is a dual diagnosis. So that means besides the substance use disorder, there's also usually another mental health issue. Not always, but a lot of the times. So it could be anxiety, it could be depression, it could be bipolar disorder, it could be a personality disorder. Basically, we treat all mental health disorders. We don't just treat the addiction. We also treat the mental health, which is important, because if people don't have their mental health straight and they can't cope with it, there's a good chance that they will continue going back out time after time. Because for a lot of people, issues like anxiety and depression are major barriers to their recovery, and if they're not on the right medication, or if they don't have the necessary coping skills to manage it, they will continue going back out and using substances to cope with it. The disease of addiction affects the individual mind, body, and soul. So this is where the therapy and meeting with the psychiatrist on a daily basis is going to help the mental part. The physical part, we have a nutritionist that meets with them. We have a personal trainer that comes and trains with them. And then the most important part, in my opinion, is the spiritual aspect. It is so important. A lot of the therapy that I do is based on spiritual counseling, because I believe that spirituality is the most important thing to the addict and alcoholic. Because addicts and alcoholics, they have this void that they're trying to fill with drugs. But if only they understood that spirituality can fill that void, they would be living much different lives. So I kind of like to introduce them to the whole spirituality thing, to educate them about different spiritual coping skills that they can use to prevent relapse and manage their mental health. I also like to use a lot of motivational interviewing, which is a very friendly approach for individuals that are still in the pre-contemplation and contemplation stage of change, which means that they're not sure yet if they want to really change or not. And this type of therapy style kind of motivates and elicits motivation for them to actually consider, long-term sobriety and how it can be beneficial to them. A lot of people that are in the preparation stage and action stage, I like to use CBT, cognitive behavioral therapy, which really is the whole premise of if we change our thoughts, then we will also change our actions. So when we start eliminating different negative thoughts, we're going to eliminate some negative behaviors. So a lot of them have cognitive distortions and stinking thinking, what we like to call, that needs to be changed. And if that thinking does not change, again, the individual will continue going back out time after time. So I use a very eclectic approach to treat my clients. Now, once they complete the inpatient part, which could be anywhere, usually on average from 21 to 30 days, sometimes more, sometimes less, it all depends on the individual, they will go on to the next phase of the program, which is called PHP. PHP stands for partial hospitalization. So in PHP, they are going to move into what we call the PHP residence. They will be living in a residential community, and on a daily basis they will be going to the center. That's where all the PHP groups are and where the PHP therapist is. So once they get to PHP, the curriculum changes a little bit. This is where they start learning more about community reintegration. They're starting to practice the coping skills that they are learning. There's a little bit more freedom over in PHP, and they can go out on passes. They can start looking for jobs. They can start learning how to live life sober again. They go to the center on a daily basis, and in the end of the day, they go back to the residence. And over at the residence, they have spiritual based meetings, 12-step meetings. They have different groups. A lot of the clients start facilitating the groups themselves, which helps them stay sober and start doing service work and come back to the inpatient to share their message. And over at the residence, that's where they start going to outside 12-step meetings, or celebrate recovery, or SMART meetings, however they choose to recover. And their sponsors can start coming on property and taking them out to these meetings. Like, this is where they're truly learning, how to live life on life's terms. Besides just working on coping skills and learning how to live life and manage their mental health and prevent relapse, they're also learning how to have fun. There's lots of barbecues and gatherings that happen at the residence. So they learn about pure joy in recovery and see that life is fun to live without drugs and alcohol. and their self-esteem is improving, and they're making connections with other addicts and alcoholics, and they're starting to find a purpose. So once they complete the PHP level of care, they move on to the IOP level of care. Once again, the curriculum changes to meet their needs. They continue learning about community reintegration and coping skills to prevent relapse and manage triggers and manage cravings and whatever it is that they might be working on with their primary therapist. The work continues. They just have a few less groups and a little bit more freedom, and a lot of them find meaningful employment and continue reintegrating back again into the community as productive members of society. So once they complete IOP, then they have IOP evening, and they come in at nighttime, usually after work, for a psychoeducational group and a primary group where they continue processing issues and any struggles that they may have going through life right now. And at the residence, there's staff that is keeping them accountable, making sure that they go out to meetings, making sure that they're working with their sponsor, making sure that they're not struggling, and if they are, providing resources for them and support. They're still part of a recovery community. And after evening IOP, they will attend outpatient, where it's once a week they meet with a primary therapist, and some of them will continue individual therapy, and people may live there for up to a year long if they need to and be part of a recovery community. So the longer that they stay in treatment, the more likely they are to maintain long-term sobriety. My recommendation is always just stay in treatment for as long as you can. If you can do 6 months, amazing. If you can do a whole year, even better. The longer they are in the treatment setting, the more likely they are to maintain sobriety when they go independent. So I wanted to thank you guys for tuning in to this family education video. It is far from being over. There's still so much that we need to cover. So the next few episodes that I'll be shooting will be about helping versus enabling. What support is available for you guys, the family members, because you're also recovering from your loved one's addiction. I will also be discussing aftercare planning and what to do when the individual does return home. I hope to see you guys for the next family education video. Thank you.